I have here with me today Jason. Jason, would you just introduce yourself to our audience quickly?
I'm Jason Pope. I work at the Salvation Army World Service Office in Washington, D.C. I'm a technical advisor for anti-human trafficking, currently working on a project that helps provide protection for children who experienced online sexual exploitation. Through that partnership, I've worked with a number of different children's homes in the Philippines, as well as children's home for the Salvation Army across the world.
So, we're talking today about residential shelters and children living in group homes in this time of COVID-19. How would you, in a group home or residential shelter setting, ensure that children self-isolate and or observe lockdowns?
It's very difficult in the same way that most of our families are self-isolating within the family group and different homes and have interactions with each other, but they protect themselves when they come into contact with someone that has come into that system from outside of it. So a person who delivers food, who comes in, we don't know who they've been in contact with. Anyone that is coming in from the outside, we should make sure we practice keeping the children at a social distance from them. Also, washing our hands immediately after any potential contact has taken place. This also occurs for our staff members. So some of our homes have staff members who have isolated themselves within the children's home and are just staying there now. And others have staff members that are coming and going and rotating, which helps with self-care for staff, but it also then causes a connection to the outside world for that home. In those cases, social distance should be practiced so that staff members don't make close contact with children that may be bringing in the virus from the outside. But remembering that children have physical and social needs. So they're, children at certain ages are going to need help with their baths. So you may come into contact with children while doing that. And if that's the case, wash your hands. Caregivers should wash their hands well before they help and also after, and just make sure that contact is going to be helpful.
Great.